So then what do I mean then? It sounds quite severe to say that we're having a lot of misinformation from Sweden's health authority. Well, let's have a look at some of the actual quotes that we have been given on our national television and in our newspapers by our experts. And remember that our authority calls anybody else a hobby epidemiologist, but they call themselves, they are the expert authority. And our government keeps on repeating, we believe our health authority, they are the expert authority on how to have a good strategy and save lives in a pandemic. Well, this is what our government and our expert authority has been saying. As soon as the corona came, we're talking February 2020, the coronavirus will not spread to Sweden. Our preparedness is good. We have reached the peak down here. The corona peak will be reached on Monday or Tuesday. So every time we don't get a peak when they say they did, they move the goalpost forward a week. Now they said that, oh, we have flattened the curve, but the curve kept rising. We will have herd immunity by April, they said on the 31st of March. Then they just changed the goalpost a bit. Oh, now in April, we're going to have herd immunity in May. Oh, well, now we're going to say in May that we'll have herd immunity in June. In the 15th of March, Tegnell praises the UK idea of herd immunity, and he writes an email, said, we have walked through all the alternatives and we've landed in alternative 3, which is the herd immunity alternative in this email. Now they say on the 16th of June that Sweden has peaked and infection rates are going downwards while we're on an upward curve. 17th of July, 40% could be immune against corona in Stockholm. 12th of July, Sweden is going to do much better than Norway in a second wave of infections. They're always comparing ourselves to our Scandinavian neighbors when they're at a higher rate and almost like mocking them that we have the right and correct method and Norway is going to pay for not following the science like Sweden is doing. The Swedish Prime Minister on the 21st of August says, we made the right choice. Sweden has made the right choice, and he was very proud of his health authority. And now on the 30th of August, as Sweden starts to finally approach Norway's level of infection, they state that their assessment proved to be correct. And on the 1st of September, Sweden's public health authority in all national papers starts to say that they are worried about the increase in Norway. Oh, well, maybe they're going to touch our curve here momentarily. Tegnell then gets surprised on the 12th of September by the increased level of infections. Sweden does not have his second wave, he states, as we are on a steep curve upwards. The audience limit is finally 22nd of October raised to 300 and restrictions for all 70 pluses are removed as we are going exponentially straight up. So then they remove restrictions. What do they think will happen? Well, they'll continue to tell us that there's no second wave in Sweden. Oh dear, 1st of November, the increase is worse than we expected. Oh, 2nd of November, oh, now we have a huge increase in Stockholm and we have lost control. And now on the 10th of November, national test capacity is overrun. So this is the type of messages that our expert authority has been repeatedly giving and feeding through the media. And this is what's been going out on our national TV. Oh, we couldn't have predicted this. There's nothing we could have done to change the system. You know, it's just because you, the population, has not been quite careful enough. It has nothing to do with the fact that we haven't given you the correct tools to be able to protect yourself. They started putting it back on the population that if we'd just been a little bit more careful with our symptoms and staying at home, then we would have been able to prevent this increase in the spread.